everyone. I'm Dr. Olena Berezovska and welcome you on my YouTube channel in postcard section. And today I have a special guest. You already met this wonderful doctor, colleague of mine, Dr. Alexander Petrenko, originally from Ukraine, but now he is studying at the Medical University of Vienna in Austria and doing PhD, mostly on genes and genetics and related to liver, as I understand, or in general. So today we're going to actually talk about liver because it's a very interesting organ. I would say it's silent organ in our body. And Alexander, can you tell us more about your work, like your your research in this area? Why you are interested in this liver topic?
Yeah. Thanks for inviting me. I think overall that's a fascinating topic, and that's why I'm studying that. Basically, an interesting point that when I was practicing medicine during my postgraduate specialization in general practice, I didn't see too much of hepatology patients. And when it was time to select the next steps, I decided to go to the basic science and to dedicate some time for a PhD project, which I'm doing right now. I thought that liver is actually quite an interesting target for medications, for testing, and actually it's very important in connection with many disorders, not specifically hepatic ones, but also many extrahepatic disorders are related to the status or a function of the liver. So I joined the laboratory of Dr. Thomas Freiberger in the Medical University of Vienna, and our key point is that our laboratory is quite translational, meaning that we have a bench site or basic scientists who are working in the lab, and also we have our clinical colleagues who are always in touch with us, and they work in different departments of the General Hospital of Vienna. So department of gastroenterology and hepatology, of the general surgery, transplant surgery, and so on. And basically that means that we always have access to the patient material, and we're trying to give some mechanistic answers to how specific processes are functioning, or which would be the most interesting therapeutical or diagnostical biomarker in a specific condition. And our main scope, I would say, this is the portal hypertension and liver cirrhosis. And my key and the PhD project is dedicated to the microenvironment. So the way how cells interact with each other in chronic liver diseases and specifically in liver cirrhosis. And even more interesting, how do the cells interact with what is surrounding them? So extracellular matrix, like all the way of the extracellular proteins you can imagine, how do they regulate what cells does, what the cell does, and how does it behave? Yeah. And the way to answer these complicated questions are indeed in the laboratory models. So we have specific mice and rats, which we can induce liver cirrhosis are either in toxic or in surgical models. We have our so-called in vitro part, which is basically the cell lines which are well established, and we can work with those. And also omics techniques, so-called genomics, transcriptomics, or basically sequencing to read the genetic variants or the RNA variety in a specific cell on the whole cell level or the whole organism level. That's what they're doing. And in my project, I have this opportunity and a privilege of working with patient material in addition to the animal materials, which is not always available for basic labs.
Like you said, you're right that we don't have too many specialists who dealing with problems with liver, because I remember one interesting case. It's the secretary of the doctor worked when he came to Canada many years ago. So 12 years ago, she got some problem, like unpleasant feelings somewhere like on the ribs, and when she went for ultrasound, they found some tumor, not a big one, but tumor in liver. And I remember how she was concerned because she couldn't find any doctor, even in Canada and United States, to do a biopsy because the tumor was in the area when it's very difficult to get the needle, get this biopsy. And thanks God she found here, actually in Toronto, one specialist who agreed to do the biopsy, and they found that it's a very rare type of tumor, a malignant tumor, and it has to be like, removed. Again, there was a problem to find a doctor who would do the operation, and she was quite young. She was not, I mean, very young, but around like 40 years old. And, and what do next? So anyway, she found a doctor who did the operation. Then she had this chemo, and she's alive and like active now, like, and she smokes, continue smoking. So she's like says she doesn't feel even that she had any cancer. And it was it was actually very rare tumor, and they couldn't find even information about this tumor, like too much to explain what is the prognosis, what is next step. And I remember this because I remember how it was difficult to find a specialist who dealing with problems of liver. And that's, you're right. And it's I don't know why, but maybe because liver for me, it's a really silent kind of mother of our body, because it cleans and cleans and cleans and produce hormones and produce substances. But there are so many functions of liver, right? And we hardly know about this function, especially like if you don't have medical ground, you don't know too much about liver. And then when the liver, like when you have pain, the liver usually have no pain, right? Except that when it's bigger in size, and the capsules gives us some pain. But inside, liver has no these receptors of pain, right? So we kind of like cannot feel the liver, healthy liver. That's why we don't feel the silent organ. And it's interesting because I think we always missing this important part of our body, important organ of our body, and only now we start more interested, because the liver, it's a way of transportation and actually
metabolizing
and production of so many substances of our body. So if something goes wrong, then we wouldn't survive, we would be dead, because this is all the liver does. And when it comes to the damage, like, oh, by the way, it's also like, I would like to talk, that we don't know about liver too much, but we know that liver cleans, like, at the same time, we have so many different, supplements, hepatoprotectors, like they call, to clean our liver, because the liver is a messy organ, or like, regenerate these liver cells. And I would like you to talk about this a little more, because it's misinterpretation of what liver does and how we can actually help liver to be a healthy organ. So you know more about this. So can you tell us now? And I would like my viewers to hear this progressive knowledge, not just like what they read in the advertisement, that it will help your liver to be healthy.
Yeah, I think that's an interesting question, and since I'm full-time scientist at the moment, I cannot really give a health advices, but I can recall a few cases from my practice in the postgraduate specialization, where people actually, were directed to me after some treatment as to the general practitioner, and they had this prescription of some things which we call hepatoprotectors and something like that. And I mean, I'm against, as a specialist, I'm against of anything that interferes with the primary treatment. And if people are enjoying for some reason some supplements, okay, I mean, but not instead of the treatment. And unfortunately, that was specifically the case. And I know that it's often a big problem in countries like Ukraine, or, for example, in developing countries where evidence-based medicine is still on the way to become, a foundation of all the medical training. I even seen sometimes with our clinical colleagues, they're discussing some interesting cases, interesting finding, and I also seen here in Austria some prescription of this hepatoprotectors, which was like one time in over 3 years that I'm working here. And my Austrian colleagues were not even aware that some of them were not even aware that such thing exists, like, because it's not in the guidelines. We have no idea whether it even reaches the liver cells or interferes with the metabolic or whatever processes in the liver. So yeah, I mean overall, what we definitely lack in the field of hepatology is selective highly targeted treatments, therapeutics, which reach the liver cells and fixes some mechanisms, whatever it is, whether it's insufficient regeneration or liver fibrosis or steatosis. And indeed, we cannot think that some wonderful herb which we intake as a pill will fix all the issues for us. And I think that's the issue. I know that some people just feel relaxed and more secure when they hear that there's some so-called natural supplement, some natural product itself. But I know a good chemist who is a friend of mine, and he always told that all the small molecules or RNA therapeutics are also natural because it exists in our nature and we don't create it from nothing. So that's also a question of terminology after all.
Until we alive, I think there's a very good balance of everything in liver. So the liver actually cleans our body very well and also metabolize necessary substances. So I think
unless it's a really advanced chronic liver disease, and this is what I meant when they're lacking therapeutics. So, for example, if in the progression of liver fibrosis, so when the liver tissue is damaged and is becoming slowly replaced by extracellular matrix like collagens and so on, there is some specific point of so-called no return when the process is not anymore repairable, and it goes straight towards cirrhosis, and ultimately such patients might even require liver transplantation because that would be the only life-saving and any possible choice to them. And this is exactly where we're lacking therapeutics to stop the progression or to reverse the progression on the very precise level. So, for example, we know which cells launched this fibrosis, issue. We know that activation of something which we call hepatic stellate cells, which become more fibroblast-like in the fibrosis, they cause this massive production of the extracellular matrix. But up to now, we don't have any effective treatments which would target them and stop this. So yeah, that's a big issue, I think, and people can actually manage a lot of things, and I think fantastic things. As you mentioned, the liver cancer, right? There are small molecules which help patients to survive. There's immunotherapy, which is a hot topic overall in science nowadays, and there are therapeutics which help to fight this liver cancer in some patients, indeed. Yeah, but still there are so many questions. I mean.
It's interesting that I don't know. I couldn't find any information. Maybe you have. Like, what is the percentage of damaged liver still can do the function properly? I mean, because with age, people have damaged organs, and sometimes it's crucial, sometimes not. But each organ has this potential to function properly until it's damaged, like in a bigger size, let's say, or like it's like you say, irreversible damage. So how about liver? Like I found like even patient who has cirrhosis or even patient who had hepatitis, they still function properly like for a long time of their life, especially if they use this healthy lifestyle and kind of like trying to be healthy. So do you have this data, like how much bad liver is safe, let's say? I know it's not the right question, but
Actually, that's a good question because I'm not aware, which percentage of tissue should remain unaffected so the liver still functions. Because usually people go vice versa, like from the liver function, from the markers of liver function, or for biochemical, markers associated with death of the hepatocytes, let's say. And this is quite varies quite strongly between the different etiologies because there are some etiologies which are overall generalized. So, for example, if you talk about hepatic non-alcoholic fatty liver disease, or for example liver cirrhosis related to alcohol consumption, it can be so generalized that you see the cirrhotic manifestations over all the parenchyma of the tissue. And I'm not even sure in this regard we can calculate the percentage of non-affected tissue, because indeed we do histology and indeed it will be different depending on which lobe we're biopsying or receiving the whole sample after the surgery, for example. But I'm not aware, which is the reference percentage, let's say. I would think it's quite different because also different etiologies manifest differently.
Yeah.
For example, there are such issues, rare liver diseases such as primary sclerosing cholangitis and primary biliary cholangitis, when overall the tissue can be not too much affected, but because of the cholestasis, so prevention of the outflow of the bile acid, the tissue damage can accumulate, and it will not be, the histology, it will not be that severely damaged as, let's say, in the terminal alcohol liver disease, but the liver function will be significantly impaired. So I think that's really differs.
Yeah, even in this case, I was talking before about the woman who had this rare tumor. They removed almost half of her liver, and she's okay. She doesn't feel that she lost half of the liver because she didn't change the diet very much, and she's quite happy. And she takes now every day as a granted, and she's happy that she's living, right? But at the same time, like you're right, it probably depends on the local damage or systemic damage, like, depends how the liver is damaged. And right now I know it's like, even there was the topic that was discussed in among medical doctors, it was about this growing of cases of fatty liver disease, and it's because we live longer now, right? And we have also a lot of people with extra weight, and still we don't know actually the true connection between fatty liver and actually extra weight. It's probably the damage that goes slowly, but by other, like, causes. And do we have more data on this fatty liver? So how we react?
Oh yeah.
Because we see it more often actually now.
Oh yes, and I just returned from the International Liver Congress, and one of the talks there was related to the public health and liver diseases. And in the past there was a significant cause of liver diseases related to the viral hepatitis, right? But as time goes, we have more and more therapeutics. For example, now we can obtain elimination of hepatitis C virus, right? And there are some very promising drugs against hepatitis B, and there's also vaccination. So the speaker of that specific presentation thought that we can even observe in maybe the next 10 or 20 years this skitters. So when the viral hepatitis will drop, but the overall liver morbidity will see more cases of non-alcoholic steatotic hepatitis. And one of the prominent factors of those, in addition to some genetic susceptibility factors or something like that, also environmental and behavioral issues. And the lipid degeneration in hepatocytes, which is something which we can observe in such cases like the ballooning and other smart namings of these processes we see. It's a fascinating thing because when we talk about different etiologies like alcohol liver disease, for example, and let's say they had a good celebration, and let's say some of us would volunteer to as a clinical study for liver biopsy, let's say, and after consumption of a moderate alcohol amounts, we still can see this lipid degeneration in hepatocytes in specific zones of the liver, like around the portal triads, because this is where these hepatocytes meet the alcohol or ethanol or whatever other substances we can think. And with fatty liver and non-alcoholic fatty liver disease, progression goes very, very silent because, as you mentioned, we don't feel the liver, something is wrong until the size is increased because of swelling or because some function is damaged too much. We see, for example, extrahepatic issues. Like, the liver is such an important organ that it even affects the systemic hemodynamics because of the changes in the liver structure. For example, the resistance in the vessels which are inside the liver can be increased. Ultimately, we can see it as a portal hypertension, and this issue even affects the way how heart pumps the blood out. So there will be systemic vasodilatation, for example, and so on. And also, another big issue is what really is this fatty liver or non-alcoholic steatotic hepatitis, because nowadays people are switching to the new terminology, which is metabolic associated liver disease, because that's always questionable when we see really effect of ethanol or bad diet or Western diet, what we can use the umbrella term, isolated, because I would expect expect that in many cases we see some combined or synergistic effect. Yeah, and another weird tricky thing about fatty liver, that it actually can lead very silently to the fibrosis, and it may be such a case that patient go into the inpatient clinic with some complaints, some symptoms, and only then the patient is first diagnosed with quite an advanced fibrosis level, let's say. And yeah, indeed, it's always a problematic question. And in a perfect world, we would have some non-invasive biomarkers, which would come from research laboratories, and we would routinely screen patients for these markers and see. So okay, probably you should have a biopsy now, because we suspect you have some tissue-related changes in fatty droplets in hepatocytes or whatever. Yeah.
The majority of people without medical background, but even doctors, let's say the truth, they know about damages of livers only like two types. It's like by viruses, when we talk about hepatitis, and now we have these cases discussed in the United States and all over the world about new kind of dangerous hepatitis. But another part, it's like some people know that damage of the liver could be because of alcohol consumption, and that's why we have like this changes in cirrhosis. Also, we have in people who have drinkers, and that's it. Like and then in most cases, like people do not know anything about liver. But also liver could be damaged by so many other substances, and not even when we talk about infectious, it's bacteria, it's parasites, it's like there are so many different causes, and also substances. It's like smoking and many other toxic substances. So I think we need to talk more about liver, and I think it's coming to the point when even doctors start talk more about protection of liver, and like you said, how we actually manage, how we diagnose these diseases, how we can prevent this dramatic events when it's too late to do anything. In the number of people who are on the waiting list waiting for this liver transplant, it's a huge, and that's why we need to deal with this, and people live longer. By the way, I know the patient, she had like 3 transplants of liver 3 times. And yeah, and she died around 60 something years old, and she's like relative of my very close friend. And I remember I was coming to the hospital to see her, and like she's, for me, really, well, maybe it was experiment in some way, because 3 times, like but at the same time I could see what she went through. And probably when the 3rd time the liver stopped working properly, she was tired. She said, I have no strength to fight and go through medications and through the test and everything. And that's why she agreed, like, stop any other efforts to save her life. But again, we don't see so many lucky patient who has liver transplantation right away. And that's an issue. That's an issue. So when we're talking about, yeah, go ahead.
I mean, I think that's a really complex thing about the liver transplantations. Because of the nature of my research, I have to be in touch with the transplant clinic quite often, because we use what is called primary human cells. So basically, whenever there's a liver transplantation, we take this old cirrhotic liver, we take a part of those, and try to isolate living cells for our experiments. For example, to see how the cells behave in a new environment, or if you treat them with some promising substances. And I always, when I see this waiting list, I always think that these patients actually go through many difficulties and issues. And indeed, the waiting term can be quite significant in many cases, because the availability of donor livers is a big issue, and I mean, and indeed it's not 100% successful after all. So I'm really happy to see these relief patients when they can be discharged from the hospital after the transplantation, and hopefully to begin new life and get a good quality of life if it works out. And unfortunately, it's not always successful as we like it to do. And again, if you think about this, we know quite a lot about the liver histology, right? Or specific cell types in the livers, or even some very sophisticated things like in which molecular pathways are involved in a specific fibrosis stage. But what they don't actually have from this right now is some therapeutics which would help this patient to live longer or have better quality of life when they're already at this stage when they have this very advanced chronic liver disease. And yeah, I think this is something we should really do as researchers in this field, just to try and bring new, very targeted and specific drugs and therapeutics. Because clinicians use all the variety of the treatments. Like there are non-selective beta blockers, there are statins, there are many other types of medications, but they are not quite that specific as we wanted. And unfortunately, there are not effective treatments to reverse these processes, or even to give a chance to a patient to live longer while he or she on this wait list. I think that's it. And on the opposite, there are many studies and many groups working with tissue engineering. So they're trying to construct this, scaffolds and populate them with cells to implant them in humans. So this is another way how to help these waiting patients, just to replace this this liver in the future with some bioengineered tissue, which would function well, which would give them this opportunity to survive longer. So I'm not aware how far this kind of research are at this moment, but I've seen some talks about that, and at least in animals, there are some really big difficulties to solve first, because it sounds promising, but we would really like to see it more effective than it's at this stage.
Actually, when we're talking about any medication people take, and if you take like orally, POs, it goes, first of all, it has to be metabolized in liver, and only a small amount of medication goes into direct bloodstream and goes to some other organs, but usually it goes to the liver, and liver have kind of like, deal with this all medication. And if it's one, it's okay, but when 2, 3, and it's a combination of medication, and definitely we don't know how it can affect liver, even like in the future. I remember I was when I was young, I had to go through chemotherapy and methotrexate because of problem with pregnancy, after pregnancy, chorion epithelioma and some other. And only in 20 years I found, because I had some lung issues, only in 20 years I found that big dosage of methotrexate can change the structure of lungs, coming like closer to, it's not like fibrosis or whatever, but also like gives this connective tissue changes. And I was surprised because I didn't know like what is the proper dosage and if it's good for my health or not. I wanted to survive, right? So I was taking any amount of medication I was given by oncologists to survive. But again, you can actually go through your life, and then in 10, 15 years, 20 years, you see some changes, how it happened. Like I'm a healthy person. It comes to liver too, and we don't know, even like sometimes like a young generation, like they drink, they smoke, they use some drugs, and then in a couple of years they wondering what's happened to the liver because liver is not working properly.
That's a big question, because at least when there's a patient on antipsychotic therapy, at least the physician knows that, for example, the specific drugs can inhibit cytochromes, specific subunits in liver, so it should be considered in. But when people intake certain substances which were never tested in I think even in animals, and there's always a question, how does it impact liver? And you're absolutely right about this all toxic or drug damaging action, because there are even animal models to simulate this, which is basically, for example, acetaminophen damaged liver injury in mice, which also reflects this, at least tries to reflect this condition in humans when we need to study something like this. And there are many drugs which are actually doing this way. So I always found it challenging when you prescribe some therapy, for example, in a combination, and you should consider whether the specific therapeutics will inhibit cytochrome in this patient, whether there's synergistic effects of this action in different drugs you prescribe. So I think that's a quite complex challenge, and yeah, I think liver is the first organ who will receive this attack, which we prescribe and hopefully manage this. But yeah,
and
this is not always the case.
I have one also interesting, I guess, question, because I always was like wondering, what actually you learned about liver, something really that impressed you, that kind of like was like eye-opener for you, even
Mhm.
knowing a lot about liver, but still, what actually something that really you never was thinking that it's this way?
Well, I think the main point is I learned how actually fragile is the homeostasis or physical state, physiological state in the liver. Because when you're learning histology in medical school, you know there are different cell types in the liver, and for example, these hepatic stellate cells, they can become activated and produce fibrosis. But what I learned when I started working in a hepatology lab, that actually there are so many ways how the cells can become activated. For
Mhm.
example, a dying hepatocyte may secrete some specific so-called damage-associated molecular patterns which are activated them, or some vascular issue, for example, may be related to drugs, may be related to something else, may damage the endothelium, and then the endothelial cells stop signaling in the normal way. For example, with so-called vascular endothelial growth factor, they or angiopoietins, they usually signal to these specific cells and they become activated. Or, for example, there's an inflammation, maybe caused by hepatitis virus or maybe caused by something else. And this infiltrating immune cell types, they also secrete some chemokines that can activate this, again, hepatic stellate cells. And this I was totally not aware of. And, knowing this, I'm quite surprised that actually not every person in the world has at some point some liver disease, or maybe we don't know about this because we just die from some other issue. But assuming that we would live 100 more years, maybe each of us would develop such an issue. So yeah, I think that was the main eye opener, how fragile all this molecular balance in these microenvironments in different people or different etiologies that we observe in the cells.
I have impression that in the liver, every cells talk to each other, like they corresponding with each other, and like providing this function of a plant, of a factory, that very important for us. I even wrote like a couple of years ago a fable for adults. It's about liver, like when I like a joke, like not a
Mhm.
real joke, but some kind of with humor. And I was always like thinking that we don't know about liver everything. It would be probably some kind of like explosion of knowledge we are getting in a couple 10 next years, because we live longer and we need a liver to normal function. So it's quite interesting, and we are getting also into the way of modifying like medication that liver can metabolize better, especially when it comes to systemic like diseases, of immune diseases, to cancer. And it's important that liver plays important role, not of destroying this medication, but actually activating this medication and bringing them to the body. And it's a future. I would like to live 100 years probably, just to know what's going on in the medicine. And, like, there's always something new, something exciting. And
Oh yeah, yeah.
I'm glad that you're here today, because you are the type of scientist and a doctor who is always like in progress. Like always want to know why and what's going on and what's new. And it's like to analyze, like you analyzing everything. And it's wonderful because we can bring this knowledge to our viewers, to people who also would like to know more about medicine and about organs, how they structure, how they function. At the same time, they don't have this high level of medical education. And I really thank you for
Oh
this
yeah.
wonderful. If you would like to say something more, I'm all in ears.
just before we finish, I think not as an eye opener, but in continuation of your thesis that you live longer, you're just being surprised how much of new things appear. Approximately, I think 8 or 6 years ago, in the liver field, they started the first studies with something which is called single cell RNA sequencing. So basically, this is a physical method which we're also trying to use right now. So you have the piece of the tissue and you use specific enzymes. So all the cells which are attached to each other or to the extracellular matrix, they are releasing and become free. And based on this method, you can actually split the cells to a single cells based on some physical methods. And then you can sequence each cell knowing that this is cell number 1 and this is cell number 1001 and so on. And in the good old days, we knew that okay, macrophages are, for example, macrophages are good guys fighting infections. Then around 10 or 15 years ago, we started to realize, okay, there are some types of macrophages which they called polarized, non-polarized. So the tolerance guys and the attacking guys. But now, when we can actually take all these cells and split them to basically the single cell level, and then based on bioinformatical tools to see which types of proteins or RNA the cells are expressing, we can see that in this whole umbrella term macrophages, for example, there are actually dozens of cell subtypes. Some cells are related to the tolerance, of against our own cells or against the spreading inflammatory process to white. Some cells, some macrophages help other cell types like T cells or whatever to actually infiltrate the tissue. Others definitely fighting infections. Some else, for example, cleaning the matrix and cell debris, which is happening, which is occurring on the site of this inflammation. And I think with these new technologies, it's something really fascinating how how basic our understanding of different cell types was like 10 or 20 years ago, and how deep it is now.
Yeah.
So I can only support you in the desire to live longer, just to see what else we will discover,
What is
which
next?
new.
Yeah.
Because I mean, this is really the page. We're turning the new page on the discoveries of our organ functioning, and probably we'll have many more answers to the very basic questions like the mechanisms of cholestasis or the mechanisms of, I don't know, cachexia and cancer. And based on these technologies, we can actually think how our cells respond to these processes. So we can definitely see many more fascinating discoveries in the future, dozens or even years.
Yeah, I have the last question. When we're talking about regeneration of cells, it's kind of like very popular topic among people who's selling supplements about this regeneration of liver cells. But when we're talking about like regeneration from medical point of view, I know that skin actually it's a very high speed or high level of regeneration tissue. And how about liver? Is it true that it's regenerate quickly, or actually it's a myth, and we have to be careful with this kind of words so that any damage of liver can help liver to recover?
No, that's actually true. That liver is very rapid regenerating organ. From it was confirmed both in humans, in animals, and even in vitro. So we can observe that that regeneration is an organ is definitely possible and it's quick. The issue is we're not actually aware, what manages it, because in like other organs we can see, for example, pluripotent or whatever type of stem cells, right? In liver, it's still a big question what is the source of this regeneration, whether there are some circulating cells or maybe cells coming with the portal blood flow or perivascular cells, or they're somewhere inside the liver tissue, but we don't know about them. I would not be surprised, to receiving any answer from the above, because, for example, in brain we also have many niches of the stem cells, which are not just all over the tissue, like for example in the skin, because in the subdermal layers we have a lot of stem cells. That's no surprise, or in the adiposa. But there are in more, I would say, complex organs, probably we have some niches. And in the liver, these niches are, an object of very deep investigation, because we are not big professionals at this moment of the technological process of characterizing these niches. So the answer is yes, the regeneration is very prominent, but we're not aware too much about the underground of this complex process.
Do you think that using the stem cells will, like in the future, will give us more chances to treat some dangerous conditions of liver? Or
I would hope so. I mean, in principle, I'm a big enthusiast of cell therapy. In practice, I'm a little bit skeptical about them, because it's always a question. Okay, so we inject some stem cells. Are they implanting? Are they, differentiating how we want them to differentiate? Are there risks of malignization of these cells? And these are all the kind of questions which are remained unanswered also in the liver. So I think it's not a big deal to make a biopsy, and make some adipose tissue from a patient. For example, take these cells to the petri dish to treat them with specific markers which promote them to convert to hepatocytes and inject back. But we don't know how it would work in the real organ. And I know there's a lot of labs working with cell therapy, stem cells, and also in the liver, but I'm not aware about any super prominent, results so far.
Yeah,
I'm sure there are some, but maybe we're just a bit far from the clinical translation of this technique right now.
Yes, it's actually the beginning, and I also read some articles, but again, it sounds promising, but quite often when it comes to practice, we have failure. And that's why
I'm just sure there is something in this field, and at some point we'll be able to use it in a proper way, in a safe way. And I'm really happy that there are some groups which are researching this, because I'm a little bit distant, from the topic of stem cells, because it's not our scope. But I think it should be. I mean, we never know when the next big discovery will be in this field, but it will happen at some point. And I'm most assured that it will actually help us and bring new treatment approaches, but not at this specific minute.
Thank you very much for this wonderful discussion about liver, and I'm sure we got a lot of interesting information, very useful information. We start thinking more about the silent organ, how to care about this organ, how to protect this organ. And all information, I want to mention again that my special guest today is Dr. Alexander Petrenko from Austria, from Vienna. And you can read more information about him under this video and information about video. Thank you very much for joining me. And I hope we'll talk about other things related to genes and our body and our health in our future podcasts.
Thanks for having me. It was interesting. Thank you.